Dr. Robert Christopher is past president of the American Academy for Cerebral Palsy and Developmental Medicine in 1987. He served the Academy on many committees, often in leadership roles, but is likely best remembered for his longtime role as historian. An early physiatrist, Dr. Christopher was fortunate to have a career spanning over 30 years in Memphis, Tennessee, in a system with leadership that encouraged him to be active in a variety of medical education academies, accreditation committees, and councils. He took this encouragement to heart, serving in leadership roles for several professional organizations, including the AAPM&R, the Board of CARF, and in a variety of community capacities that directly served individuals with disabilities. He relished the opportunity to learn from and engage with medical professionals from different specialties, and describes his experiences of visiting hospitals and facilities in the accreditation process as an opportunity to learn and bring new ideas back to his own facility. And to this day, Dr. Christopher is a champion of the Academy as a melting pot, bringing professionals together to share their experiences in the many ways they care for patients and their families. He lives in Vero Beach, Florida with his wife, Doreen, of 59 years. Dr. Christopher continues to serve his community as Vice President of the Board of Directors for the St. Vincent de Paul Society and volunteers on the Parish Council for the St. Sebastian Church. Despite the lasting effects of polio, he swims daily and enjoys art and theater. He and Doreen have 3 grown children and 5 grandchildren.
Well, 1955 was the end of my first year of medical school, and I was home in the summer and contracted poliomyelitis. It was, a matter of fact, only about 3 months before the polio vaccine came on the market. I was one of the last. I was placed in the city hospital in Cleveland, and my doctor was Dr. Nadine Coyne, who was a specialist in physical medicine and rehabilitation. And I'd been there only a few weeks, maybe 6 weeks, and she came into my hospital room and she said, you're getting physical therapy every day and you're really making good progress. But she said, you know, physical therapy is exercising your body. We have to exercise your brain. And she said, I have student nurses coming from Western Reserve University, and I would like you to give lectures, 3 lectures on motor nerve function and how the spinal cord and brain connect with the muscles and make them work. And my immediate reaction was, I said, I've only finished 1 year of medical school. She said, yeah, but you've been taking physiology. And I said, yeah, we completed the physiology course the end of the freshman year. She said, I'll help you. I'll be in the lecture room. And she said, but I want you to make up these lectures. And she said, here's some books to help you. And so I did that. And then after that, she'd come in every morning and we would make rounds together on the polio ward, where we had many patients, some respiratory patients and some not. And she began talking to me about the specialty of physical medicine. She said, you would be perfect, because she said, when you're dealing with the patients, you can truly say, when they have complaints, I know where you're coming from, because I've been through that too. And she said, that makes a lot of difference with patients, to know that they're talking to somebody who's had personal experience with the same problems. And I said, gee, I never thought about that. And the more I thought about it, the more it made sense. And I did want a specialty that was dealing with patients, because I had been thinking about some that don't directly deal a lot with patients, like radiology or pathology. And then decided, gee, no, I want to deal with patients who I can talk to, not those who are dead. And so it was a perfect fit. And she told me that, she said, St. Louis U, she said, you know Ottokar Maychek? And I said, no, I never heard the name before. She said, well, he's at your medical school. He's the head of physical medicine there. And she said, you need to talk to Dr. Maychek when you get back to St. Louis. I said, well, that's assuming they will take me back after the fact that I'm in a different situation now. I don't have the use of my legs like I did. She said, but you're doing well walking on crutches with braces. And she said, I don't think that would be an impediment to getting back in medical school. And she was right. But she was my first influence, and she got me to think in that way. Now, during my freshman year in medical school, I had kind of leaned towards musculoskeletal medicine. I was thinking orthopedic surgery or neurology as a specialty. So this was the closest to those specialties that you could get, because we work a lot with patients who have seen neurologists and orthopedic surgeons. And so it not only made sense to go into a field like this, but it was related to my original interests during my first year of medical school.
And how did you ultimately end up working more with cerebral palsy patients and individuals with developmental disabilities?
Well, there are different branches of what is called rehabilitation. I mean, psychiatrists are mental rehabilitationists, you might say, and so forth. But when I was at the University of Michigan, we dealt with people with all different kinds of disabilities, adults and children. And I found my interests drifting more in the direction of children. There, I really enjoyed working with them because they always had such a good attitude. They weren't crying about their disability like often adults will do. They were just making the best of a bad situation. And I liked that attitude. Never really turned me on dealing with stroke patients, because oftentimes all they did was complain about their disability and how much they could do before, like they could play baseball with their kids and they could go swimming in the ocean and things like that. And but the kids, God bless them, all my kids, they lived one day at a time. They didn't worry about tomorrow. They worried about what they could do to get through the day. Yeah. And I like that attitude. So when I finally accepted a job at the University of Tennessee, part of the reason I accepted it was that they had affiliated with them a children's rehabilitation outpatient center, which was Le Passé Children's Rehabilitation Center. And I thought, boy, that sounds interesting. And then when I went down and visited, I thought, oh, man, I'd love to work in this place. I'll work with adults too when I'm asked, but I really think that working with these kids is what I want to spend my life doing. And God was generous to me and let me pursue my interests.
That's really cool. That's awesome. You've told me a little bit about Dr. Nadine Coyne, and she clearly was a big influence on your early decisions in your career. I know she was a mentor of yours. Can you tell me about some of your other mentors?
Well, of course, Dr. Coyne was the pediatric rehabilitation specialist at Western Reserve University in Cleveland, and was my doctor during the 5 months I spent in the hospital, and then the 9 months of outpatient treatment. Nikki, as we called her, was one of the early pioneers of our specialty. Yeah. And she was like a second mother, believe me. She just, I can't say enough about Nikki. But as far as other people, let me refer to my notes here. I want to don't want to leave anybody out.
I know Dr. Maychek. I think you
And
mentioned.
yeah, when I got back to medical school in my sophomore year, I contacted Dr. Maychek, and they didn't have a fully developed department at St. Louis U. He was really only part-time. He had a private practice in his own office in St. Louis, and I told him what had happened to me, and because he hadn't met any of the freshmen. His lectures were given during the junior year, and so he said, "I'm over there two mornings a week," and he said, "If you're free, come over and we'll talk." And so I went and had a couple meetings with him, and he said, you get an elective in your senior year of 1 month that you can spend wherever, in any part of the medical school, any part of the medical faculty that you want. And so I said, well, that you're going to be my recommendation for my month of choice. And so I did make rounds with him several times, and I also watched him working with outpatients, so forth. And he further strengthened my desire to go into the field beyond even what Dr. Coyne had done. And so I always felt very indebted to him. He was very, very nice to me and extremely helpful.
Yeah. And how about Dr. Bender?
And well, then when I got to the University of Michigan, well, first of all, at the end of medical school, well, really during our senior year, we were all encouraged to apply for, then in those days they called it an internship. Now they call it the first year of residency in most specialty training programs. Physical medicine rehabilitation did the same thing. But at that time, it was 1 year of internship and 3 years of medical school. Of graduate training in the specialty. And so I looked over the different programs in the country, and I thought, well, Ann Arbor is only 150 miles from Cleveland, so at least now that I have the chance, I could go into a program that's much closer to home, because here I am in St. Louis, 640 miles from Cleveland, and I miss my parents, and I miss my brother.
Yeah.
And anyway, the Michigan program had a very good reputation. I looked it up. I talked to some other doctors in the specialty, and so they did accept me. Went to Ann Arbor, and Dr. Bender was one of the first faculty members that I talked with, and he was running the pediatric rehab department of University of Michigan's physical medicine department. Mm-hmm. And told him of my interest in children, and he said, well, yeah, he said, you can attend all my cerebral palsy clinics and all my muscular dystrophy clinics.
That's great.
He said, well, that's where I work with the most of my children. And I did over this 3-year period. And
that's great.
He taught me a great deal, and he gave me a lot of food for thought, And he, along with Dr. George Kepke, who he really worked mostly with adults. And in my second year at Michigan, he finally got an inpatient rehabilitation unit opened at the University Hospital. He'd been trying for a couple of years and had some obstacles to overcome, and finally got that completed. And we opened a 10-bed rehabilitation unit, and I was the first resident on that unit. He said, I want you to be my first resident up there, because with your disability, you can relate to these folks, and they'll listen to you more than they will to us able-bodied people.
Exactly.
And so I spent a lot of time with George Kepke and with Len Bender, because they were the ones that were most instrumental in my teaching and supervising me and so forth. George taught me how to do electromyography and other techniques of injecting muscles, things like that. But they were just, so helpful, and always had me looking to the future.
Yeah.
And it meant a lot to me.
They sound like amazing mentors. You were very fortunate to have them.
They were. And George Kepke actually helped organize another organization of our specialists called the Association of Academic Physiatrists, which is people in our specialty that are full-time in medical school or even part-time. And so the Association of Academic Physiatrists, with their annual meeting, they deal more on teaching issues and how to teach the medical students from the standpoint of various kinds of illnesses and disabilities and how to manage them.
That's it.
And it is a very important part of our specialty.
Absolutely.
No.
Absolutely. So who have been your most cherished friends within the academy?
Well, there's many. I first think of Elliot O'Reilly. Dr. O'Reilly, as a matter of fact, was chairman of orthopedic surgery at St. Louis University. I would not have met him until the junior year when they gave us some lectures on orthopedic surgery, and I did. But he didn't remember me when I came to the Academy for Cerebral Palsy. I actually joined in, I think it was 1981, at the suggestion of Dr. Bender, because Dr. Bender was a member, and then eventually he became president. Dr. O'Reilly also is a past president of the CP Academy. And but at the time that we got to know each other well was when he was the historian and served on the board. And I was asked to serve on the board as it was called an at-large member. You weren't representing any particular organization. And he said, well, I'm glad to know you. I said, well, I've met you before. He said, you have? I said, I was a student at St. Louis University when you were the chairman of orthopedics. And he said, I don't remember that. I don't remember you. And I said, no, you probably wouldn't, because I was just in a whole bunch of freshmen and so forth. And then I said, after I had polio, I said, I was sent up to orthopedics to be examined to see if I could come back to med school, but I didn't see you. I saw Bob O'Brien. And he said, yeah, he was my vice chairman of orthopedics. And I said, it just happened to be he was the one that was on call that day and took me. And so I said, I was just one of those many faces you lectured to at St. Louis U. And we became very close friends after that. And a year later, he said to me, pretty soon I'm going to be retiring and leaving this job as historian. And he said, I want you to come on the board as my assistant historian, and so that you can learn the job and what the historian does and so forth. And so we were, every board meeting, and there are 3 board meetings a year, we were sitting side by side and working with him.
And it's my understanding he had been the historian since its inception. Is that
Yes,
correct?
that's right. Yeah.
Wow.
When they first realized the need for a historian, because the biggest part of the historian's job was keeping up with motions that were passed by the board, because sometimes the board would pass a motion that had been passed 2 or 3 years ago, but they didn't know it because they were new on the board. And
Yeah.
So I had the minutes from all of the board meetings going back to the beginning
Wow.
to 1948.
Wow.
And I could consult those when I was in the board meetings, and sometimes just put my hand up and say, you know, we took care of that 3 years ago, so you don't have to do that.
Yeah.
You're already empowered to do those things. And the board seemed to feel that this was a very important role, that this was something that they needed to keep doing, because they don't want to just reinvent the wheel, you might say.
Mm-hmm.
And so then a couple of years later, Elliot O'Reilly retired, and then I took over as the historian until 2001, when we moved from Memphis to Florida. And I thought it would be better to turn it over to somebody who was a little younger.
Yeah, yeah.
And
Well, I think you passed it on to Dr. Scherzer, and I'm not sure that he was a little bit younger.
no, he might have been the same age. But yeah, I asked Al Scherzer if he would take over the job, which he said I'd be more than happy to.
He loved the job, that's for sure.
And yeah, Al's an interesting guy. He knows more about birds than anybody I've ever met. And with pictures, wow.
Yeah.
But he's a wonderful guy.
He is a wonderful guy. And how about Dr. Alexander? I know that you were very close with him as well.
Yeah, Mike and I knew each other through the Academy of Physical Medicine and Rehabilitation. And we met at one of the annual meetings, and he was in a wheelchair. And I asked him why, and he said polio, and I said, me too. And after that, we decided that every year when we had the annual convention, we would go out to lunch together or go out to dinner if our wives were with us, and which we kept up as kind of a tradition for more than 10 years.
Yeah.
And then we'd be on the phone back and forth between each other several times a year. And I still consider him a close friend. But the first year that we really got to know each other well, I talked to him about the CP Academy, and I said, you really ought to be a member, because all of his work was pediatrics. And when he trained in physical medicine at Ohio State, they were able to work out a program with the Department of Pediatrics where Mike could spend not 3 years in just 3 years in physical medicine, but he could spend an extra year and kind of in those 4 years go back and forth between pediatrics and physical medicine, and be certified at the end of the training to both take the board exams in pediatrics and in physical medicine, which he did.
That's great. Yeah.
And after that, Ohio State continued to offer a joint program like that. And another good friend of mine, Peggy Turk, took that, and she became board certified in both fields. And Peggy never was very active in the CP Academy. She was a member, but she wasn't. She just said she had too much to do.
Yeah.
And then Ohio State actually started offering this joint program to other people. And another one was Claire Wolf, who was in physical medicine. I tried to get her in the Academy for Cerebral Palsy. She never had the time. She was too busy. But she was elected to the board of the American Medical Association. And was a good representative of our specialty. First physiatrist that was ever on the board of the AMA. And then later became president of the AMA Senior Citizens Advisory Group for retired physicians.
Wow.
And she's quite a gal.
Neat.
So, getting back to you, you became president of the Academy in 1987. Can you tell me a little bit about that meeting and what were the highlights?
Yeah. Well, first of all, the meeting that year when I was president was held in a great venue. We were in California, right across from Disney World. We stayed at the Hilton, and that was our headquarters hotel.
Fun.
People could walk across the street into Disney World. Well, that one they called Disneyland out there. And so, as a result of where it was located, it was the largest one we had had up to that date.
Neat.
We had great attendance, because people could bring their kids and their wives and all of that, and they could have a great time while everybody else was in the meetings.
That's fantastic.
And so it was in Anaheim, and they gave us a huge suite. The president always would stay in a suite at the different meetings, but that year, that suite was enormous, and it had this huge, well, it wasn't a bathtub, it was really a hot tub, but it was in the bathroom. The bathroom was so big. And my wife just enjoyed taking bubble baths in that hot tub, which I won't forget. But I was trying to think of I was allowed to invite a guest speaker.
Okay.
And I was trying to think who it was now. It escapes me.
Well, I remember that you've told me that the topic of the meeting was treating the whole person.
That's right. That's right.
Does that help
And
ring a bell with the speaker?
Yeah. He was a pediatrician, and I can't think of his name, but that was the idea, that treating the whole person, that we can't just treat their disability. We have to treat how that affects the functioning of the rest of their body, and how it affects their relationships with their family and other people, and so forth. And I got several speakers talk at the different sessions on that very topic. You know.
And you had roundtable discussions on multiple specialty care. I think you.
Yes, we did. We had, they were called the role of rehab medicine in orthopedics, the role of rehab medicine in neurology.
Neat.
You know, the role of rehab medicine in psychiatry, which many people never thought of. But our occupational therapists oftentimes worked with mental health patients.
Absolutely.
And, you know, we were responsible for the training of the occupational therapists from the medical side of things.
Yeah, it sounds like the academy meeting, because it's a multidisciplinary academy, would be a perfect place to have that kind of opportunity.
Well, because we did have members of the academy who are from all those specialties.
Absolutely. Yeah, yeah.
And we even had one on the role of rehab and general practice. Because those, God bless them, those general practitioners, they take people with all kinds of different problems. And they do need specialty consultation quite often.
Yeah.
So it was well received. The feedback we got from people after going to the meeting was very positive. They thought it gave them a lot to think about, and that they would look more towards treating the whole person than just their disability.
Exactly. You guys, physiatrists get it. In my opinion, physiatrists get it. You guys understand treating the whole person, and that's the way you're training.
And that includes treating the family, dealing with the parents and the children, so forth. You know.
Absolutely.
Of course, I met people as members of the academy, like Dr. Al Scherzer and Leon Greenspan, who at that time was head of the pediatric unit at the Rusk Institute of New York University. And that had been founded by another past president of the CP Academy. I'm trying to think of his name. He's passed away a long time ago. And then Leon was his student, and then Leon took over that role. And they had a large pediatric unit at NYU.
Was that George Deaver?
Yes,
Yeah.
that's who it was. And George Deaver was one of the founding members of our specialty. He was on the American Board of Physical Medicine when it was first founded. I never met him. He was before my time, but and then Leon had taken over the job, and Leon had a great sense of humor. I used to enjoy him because he always had stories to tell, and it'd always make you laugh.
Yeah.
But he was very instrumental in helping found the academy too.
Yeah. There's some. I think the people who they were visionaries. You know, they all had a very creative minds and understood a lot.
I forgot who coined this term, but somebody made the term one time when it was a doctor. He said, "I was standing on the shoulders of giants," and that's the way I felt.
Yeah.
That I wasn't one of those giants, but I was on the shoulders of those giants, and I did get to meet some of them. And they were in the fields of orthopedics and neurology and psychiatry and physical medicine and pediatrics. They were the founding members of the Academy of our Academy of Cerebral Palsy, because that was the disease that they saw more frequently in children. The musculoskeletal disease, that's the one they saw more frequently. They saw polio patients too, but they saw a lot more cerebral palsy patients. And for years it was called the American Academy of Cerebral Palsy, and then I think the first or second year I became a member, it was changed to Academy for Cerebral Palsy and Developmental Medicine, because we thought that was a broader term for any kind of developmental disability, including dystrophy, including congenital deformities, everything, even pediatric amputees and so forth. So the scope of it, that's one of the things I loved about the CP Academy. It was really, its scope was enormous, and could encompass any kind of disability in the child, all the way up to age 18. Yeah. And one of our early statements that will appear in the pediatric journals is that we were saying, from the standpoint of the Academy for Cerebral Palsy, that those persons' needs don't end when they turn 18 and they're no longer considered children. And we have to make sure that they get the proper care as adults. Yeah. Not necessarily directly from us, but at least from people who are knowledgeable in childhood diseases. I mean, the diseases that came on in childhood.
Exactly.
Yeah. And follow through. And actually, I had many that I followed through their childhood and also into their adulthood.
Yeah. So, how do you think the field has changed, for better or for worse?
Well, of course, it's the biggest way in which it has changed is the recognition of the importance of rehab medicine in this total picture of these disability diseases. When I joined the specialty in the 60s, it was every time I would introduce myself to a new patient, I'd have to explain who I was and what I did. Yeah. And a lot of times they said, well, you're just a doctor who practices physical therapy. And I said, no, that's not that at all. I said, I train therapists in the medical aspects of their specialty, but I said, I'm not a physical therapist. I don't do exercises. I have people working with me who do that. And, as time went on, I had less and less need to explain because people said, oh, I know what physical medicine is. And so more recognition of the role of physical medicine in cerebral palsy management and other similar diseases. But even today in 2021, there are still a lot of people who don't understand our specialty unless they've had somebody in their family that went through rehab. Then they do, and they're usually converts. I mean, they not only know about our specialty, but they're enthusiastic about
Sold. Absolutely.
it. Both from the standpoint of what we do and the standpoint of the fact that we are holistic doctors who try to treat the whole person.
And over the lifespan.
And yes, from cradle to grave.
Absolutely.
That's one of our philosophies.
Mm-hmm. And what are you most proud of in your career?
Well, the story is that I would like to tell you is about a patient, and it really led me to be most proud of our specialty. And this was a case where, as I mentioned earlier, after I came to Memphis, I started working over at the Les Passé Rehabilitation Center, which was founded by a group called Les Passé, which is a group of philanthropic women who raised the money. And Dr. Louis Britt, who was the medical director, showed me around the university and helped me to get oriented to the entire place. And then I started seeing patients over at the rehab center, as well as I had another office within the university complex to seeing adults. And I had forgotten about this, but about 8 years after I came there, we hired an occupational therapist. And the first day she was there, I was introduced to her, and I said, I know you. And she said, you should. You took care of my daughter about 5 years ago. And I said, oh, that's right. How is she doing? She said, oh, fine. She said, you were treating her because her feet were turning out, and she was having trouble balancing. She was very clumsy. And so she said, you put her in some special shoes, and you gave me some exercises to do with her at home. And I said, how's she doing now? She said, oh, she's playing tennis. I said, my goodness. She said, well, she was 3 when you saw her. She's 8 now, and she loves tennis. And occasionally I would see the OT in the hall. I said, how's your daughter doing? She said, she's in tournaments now, and she became a tournament tennis player. Enough to get her a college scholarship on the tennis team at the University of Tennessee. And she said it was all because you straightened her feet out so that she could really balance herself and move fast. And that story really made me more proud of my specialty than anything I can think of, that we could change somebody's life that dramatically, even to the point of developing perfection in their skills. Wow. And so it's always stuck in my mind as the pivotal point at which I became really, I was already proud of the specialty, but much prouder, I guess you would say, than I had before.
Yeah. Wow. That's amazing. What a great story. What a great story.
Yeah.
You've also mentioned to me that, serving on the board of CARF was I know it's a different type of proudness and
yeah.
more of a career, I think.
Well, I was asked to carry out accreditation visits to rehab centers around the country for the Commission on Accreditation of Rehab Facilities. they had called me one day and told me that I had been recommended. And they said they only take about 2.5 days, and we won't ask you more than 3 or 4 times a year. And so at that time I was at the University of Tennessee, and I went to the dean and I told him, I said, they would like me to do this. This means that I would be away for 3 days, maybe 4 or 5 times a year. And the dean said, I not only want you to do it, I would order you to do it. And I said, oh? He said, yeah. He says, since I've been dean, I've been doing accreditations for the AMA of medical schools. And he said, you know, Bob, every place I go, I learn something that'll help us back in our program here in Memphis. And he said, I know that it will be the same for you, that you will learn stuff you can bring back to your rehab center. And so he said, I definitely want you to do that. And don't worry about your salary. We're not going to dock you for those days. You'll get your full salary because we think what you're doing is important for the university. And that, again, was the same kind of attitude that I had at St. Louis University. I mean, I had experience at St. Louis U when they took me back after polio, because our dean at Tennessee, Dr. Maston Callison was his name, was very forward-looking, and he encouraged us to visit other schools, and when it's being done at no expense to the university other than our time, that's an ideal way of getting information that helps improve our own medical school.
Absolutely.
And so I started doing that, and they sent me everywhere from Massachusetts to California at different times to do these accreditations.
Yeah. Wow.
And then subsequently I was asked to serve on the CARF board as a representative of the Academy of Physical Medicine, which I did for 13 years.
Yeah.
That initially, the CARF had their headquarters in Chicago for many years. So the first 2 years I was on the board, I was going to Chicago twice a year, usually in May and in December. And then they moved to Tucson, Arizona.
Oh, nice.
And so for 9 years, I went to Tucson twice a year. And particularly when you go there for the December meeting, I would leave Memphis, and our winters were mild in Memphis. It might be 40 degrees in Memphis. I'd get out there and it was 85 and sunny and beautiful.
Beautiful, yeah.
And I always looked forward to going out to Tucson.
I'm sure. Wow. So do you have advice for current members of the Academy?
What I would advise the Academy was to continue what they have been doing to broaden their membership. That not only orthopedic surgeons and neurologists would have interest, and we have a good number of pediatricians in the Academy, but I think family practitioners and people in other fields would greatly benefit, whether they see children or if they're only seeing adults. There's a lot in there that would be of help to them. But I think particularly the family practitioners, I think if they have a large pediatric load, they're going to have a number of disabilities. And it would benefit them to, even if they don't join the Academy, at least come to the meetings. And so I think doubling the efforts towards other specialties would be a boon to the Academy, but it also would be to general medical practice.
Absolutely.
So that's probably the crux of my advice.
Yeah. I think it's pretty good advice. And that's part of the neat thing about the academy too, is that it's welcoming to all specialties.
That's
and
right.
it
It has a
encourages-
broad base.
Yeah, yeah, and
and-
you don't see those family practitioners, and I know so many families are leaning towards
And
that.
I think we need to, we have a good number of membership from the allied health professions, from physical and occupational therapy, but we need to expand that further too.
Yeah, I agree. Well, how do you want to be remembered?
Well, I suppose as oftentimes people, you don't think about things like that, but I guess I'd like to be remembered as one of the guys who did his best during his presidency to expand the membership and to involve more both medical, nursing, and allied health people in the field. And I thought we were fairly successful that year. So that'd be about the sum and substance of it.
I like to call you the chief recruiter. Every time I've talked to you, you've been very, very, very encouraging of bringing in other people from. That's definitely been. I can tell that's at the heart of what you care about is really encouraging.
Well,
people
anytime
to
when I
join.
got to know colleagues at the university and in the practice community in Memphis, I would ask them if they saw any children, you know, and some of these were general surgeons and so forth. They go, well, yeah, sure. And I said, have you ever heard of the Academy for Cerebral Palsy? You know, no. And I tell them about it, and they said, well, maybe I ought to look into that. I said, well, you really should. I said, meetings are wonderful. I said, they're very informative, and I said, and we have great social events. So most of the guys bring their wives along and their kids if they're young, not in school, because I said we always have them in venues where there are other things to do besides just go to meetings. So they found that attractive. I said, you know, you can combine a meeting with a vacation.
Yeah.
And so I was responsible for a number of people joining the academy. I found out later,
Yeah.
you know.
I think you benefited from a medical system or a hospital and employment that really encouraged you to take part in these meetings and you know. And
Well, that's right, and I know that you know, doctors are in busy practice, and their overhead is so high nowadays they can't be away too many days a year. It's like a couple of the guys I knew in private practice in Memphis who said, you know, you can go because if you go, your salary continues. He said, when I'm out of town at a meeting, there's no money coming in, but I still have to pay my secretary, my nurses, my technicians, and so forth, and the rent for my office space. And they said, you don't have to do that. I said, I know. I said, we're blessed. I said, I can go to 5 or 6 meetings a year.
yeah.
And they said, you know, if we get 1 or 2, we're lucky because we just can't afford it.
Yeah.
That's just a reality.
Right.
I said, well, I promise you that you come to one of our CP Academy meetings, you will find it time well spent.
Absolutely.
Oh.
So what gives you hope?
I think what gives me the most hope now is the fact that the concept of holistic medicine is being embraced by more and more people in various specialties. We have a lot more orthopedic surgeons today who now are not just looking at the broken bone, but they're looking at how that affects that person, their relation with their family, their job, and so forth. And you can tell from reading the journals, and I still try to keep up with a number of them, that they're looking at their patients with much more of a holistic philosophy than ever before. And I think that's going to continue to grow because the patients are demanding it. You know, I'm very optimistic about that.
And do you have anything to add?
I think the one thing I would say is that when the Academy moved its headquarters to Milwaukee, we were all kind of a little frightened and concerned that this wouldn't work out. But I think the group there has been so supportive, so helpful in so many ways. It just kind of saying to all of us, you just tell us what you need, we'll get it done. And they have come through. They've done a wonderful job. And I would just say to the Academy, don't change your management company, because you got one of the best ones in the country. And every little thing that you mentioned to them, that some convenience during the meeting or stuff like that, they would make sure that it gets done. You know, I kudos to them. I just cannot say enough in support of this group, this management group. I think they're just doing a great job. And I want the Academy to stay with them. So.
Well, thank you.
Yeah.
That was great. Thank you so much, Dr. Christopher.
Well, it's been my pleasure. I'm glad to be alive to be able to do this. At age 89, I thought I might be up playing a harp or something by now. But the Lord left me here, and I was glad to meet with you.
This has been wonderful. I've truly enjoyed it. It's been a lot of fun getting to know
And
you.
I would say hello to all my friends in the Academy.
Yeah. Well, they'll all get to see you virtually for sure, and it'll.
And to the people that are new in the Academy, you've joined a great group, and you will get more out of it than you put into it. I felt that I did.